Just a quick note, and I can't remember whether I'd mentioned this. In fact, I don't think I did, but I did mention about the importance, in my opinion, of customizing your questionnaire as regards to sleep disordered breathing and the signs and symptoms that they've either noticed or experienced, and that is, it's a good idea to do that, because when you do that, you can use those problems. You can offer potential solutions to those specific problems that they've actually written down, and that makes a lot of sense. But there is another side to that which is worthy of mention, because it's an even better reason for doing that. I don't know your experience, but from mine, when I see a patient, in the past, I try not to do this now because that's why I'm telling you or sharing this. What I've done in the past is I know that there are many potential benefits for an oral appliance, and if a patient comes in and they've got mild to moderate, or even moderate to severe, then I will go over all the possible options, obviously, but in order to try and get them interested in resolving their problems anyway, I will go through, did go through all the benefits that that potentially exist on treating or managing their problems, but more specifically sleep disordered breathing as a whole. So I might say, it's been associated with essential hypertension, or I'll say blood pressure when you don't know what the reason is. It might be that it's snoring, which is a biggie. It might be that it's excessive daytime sleepiness, it could conceivably be even, I don't like using this because it's a bit of a, I don't think it's really entirely fair, but weight loss, and it's been shown that, we're going off the subject here, but I will just finish that sentence. Present studies tend to indicate that may be a cause for weight gain, but treatment or management doesn't necessarily result in a weight loss. But we won't go there because that could be somewhat controversial. But anyway, getting back to what I was saying was, yes, okay, so those are a good idea, and I'm always very enthusiastic about telling people about the potential benefits to their problem. But here's the thing, if you don't customize it, and if you have a sort of general questionnaire, and you tell someone about all those potential benefits, they will pick on the one thing that you've said, which is true, but they haven't got, as a reason for not doing anything at all. So if they've got 3 things, but you mention a 4th thing that they don't happen to have, they'll forget the 3 things and use the 4th thing as a reason for not having it. Well, that's my experience anyway. So if you have a customized questionnaire and you stick to the things that they have as a problem, then what doesn't happen is they don't say, yeah, and then right at the end say, yeah, but see, the thing is, I'm not sleepy the following day. So, and it's almost as if they're saying, so I don't have a problem, and so the first 3 things suddenly become quite ethereal and non-consequential. So I mention that only because I'm not a psychologist, but I've been treating patients long enough to know that deep down nobody wants to have anything done at all, and that's perfectly reasonable, and I feel the same way too when I go to the dentist. But if we're going to help people, we need to show them, we need to illustrate, A, that it's worth it, but B, it's worth it for them. So anyway, that was a very long way of getting around to say there's another reason for a customized questionnaire, and that is so that you can pick and choose the specific issues that they are having problems with. Just to go over generically, everything is probably a less effective, by a long chalk, less effective way of doing it. Anyway, long story short. Okay, thanks. Talk to you soon.